Have you ever had a nagging pain in your tendon and you've wondered, is it tendonitis or is it tendinosis? Or maybe you've had that nagging pain, you've tried treating it like a tendonitis, but it's not actually getting the results that you're looking for. Then what you're suffering from may actually be a tendinosis. Today, we're going to discuss the difference between a tendonitis and a tendinosis and why it's important to know which one you're suffering from in order to determine the best treatment for you. Because the treatment for a tendonitis versus a tendinosis is very, very different. I'm Dr. Amy, PhD trained orthopedic manual physical therapist, and I recently had a patient come into my clinic who thought that what he was suffering from was a tendonitis. However, upon further examination, we actually did an ultrasound to look at the tendon itself. We found that it was actually a tendinosis. Now, this was really critical to be able to identify because the treatments are so different for these two. So for him to be able to get the results he's looking for, it was important to look at the tendon under ultrasound to know if it's a tendonitis or tendinosis. However, I could also tell just from what he was saying in the history, and I'll share that information with you today. First off, let's discuss what tendons are because that is super, super important as we talk about tendonitis and tendinosis. So tendons specifically attach muscle to bone, which means that they are all attached to muscle fibers. So people are pretty familiar, let's say, with the Achilles tendon. They may feel like what they're suffering from or their pain is due to an Achilles tendonitis, and it may be. However, we have tendons throughout our body, and any of them can start suffering with a problem. Another spot in our body that it's really easy to see tendons is in our hands. So on the back of your hands, you can see these things that move around as you move your fingers, and you're like, oh, hey, yeah, that's actually a tendon. It's attaching the muscles, which actually in this case in your hand, are way up here in your elbow to the bone, which is in your hand. Now, tendons are pretty fibrous. They don't tend to bend or flex very well. You may have eaten a chicken or a turkey and notice those tendons that are attached to those muscles. So the muscles are meaty, right? But those tendons are almost kind of like straws, right? They just really seem like they're not extremely flexible. They also don't have great blood flow. So that can be a challenge if your tendon gets injured because there's not a lot of great blood flow unless there's other tissues around that do have good blood flow. So you do have tendons in certain spots in your body, like in your quads, in the front of your thigh, in your hamstrings, in the back of your thigh, or other areas in your body where there's a ton of blood flow because there's a lot of big muscles around in the area. This does tend to help bring more blood flow to those tendons. But when you're talking somewhere like the hands, which there's not a lot of big muscles in the hands in general, it can make it way more challenging. All right, so let's define some terms. Tendonitis versus tendinosis. So a tendonitis is a sudden acute inflammation that's often due either to repetitive stress or an acute injury. So this could be you were out playing soccer, rolled your ankle, and started having an Achilles tendonitis on the back of your calf. While a tendinosis is a chronic degradation of the tendon over time, due to overuse or aging and not associated with inflammation. And that is a key factor because a tendinosis does not have a chronic inflammatory capacity. Basically, it has already gone through its tendonitis phase and there's been a lot of inflammation that didn't heal the problem and you continue to wear down at the tendon. And now there's not any blood flow directly impacting it in order to be able to heal it. So the story I most commonly hear is that a 40-year-old male who used to play soccer when he was a teen goes out to coach his kid's soccer team and his Achilles tendon snaps. And he's like, I don't understand what happened. Well, what happened is that there was probably a tendonitis that happened way back when. You kind of ignored it because, you know, you're a teenager and you can get away with stuff like that at the time. And then you go out to play soccer as an older person, but this tendonitis has transitioned to a tendinosis. There may not have been a great warm-up, but it could be that the tendon's so damaged at this point anyway, it didn't matter if you did. and the tendon just snapped, which is no good because at this point, in general, you're probably a surgical candidate. So let's figure out what you can do about that tendonitis and a tendinosis before you get to that point. Now, tendonitis and tendinosis have very different symptoms or very different representations. A tendonitis will have a sharp pain, there will be redness, warmth, swelling, all of the things that we usually see associated with inflammation. That's what you'll have with a tendonitis. A tendinosis is very different. Again, this is not an active inflammatory phase, so you'll usually have a dull, achy pain and a significantly limited range of motion. Or I should say, a significantly limited range of motion over time. If your tendinosis is just developing right now, your range of motion may only be a little bit limited, which means it's a great time to work on it because you don't have a huge amount of dysfunction yet. Basically, tendonitis is the red flag saying, hey, there's something going on here. I need you to fix this. While a tendinosis is more of a long-term wear and tear type of issue. It's already been through the tendonitis, and now it's on the tendinosis. Now that you understand the difference and the symptoms between tendonitis and tendinosis, what is the difference in the treatment? Well, with a tendonitis, you want to decrease the inflammation and you want to restore normal movement. So you'll want to use ice to help decrease that inflammation. You'll want to move through normal ranges of motion. And this can be really helpful to figure out with a physical therapist of what is safe for you to do while you're in that tendonitis inflammation phase. Because you do want to be moving, and movement is important because that is what brings blood flow, which is what brings healing. However, you don't want to be moving in such a way that you're aggravating the tendonitis and therefore prolonging your symptoms. Now, a tendinosis is going to need more aggressive treatment. First thing, we want to focus on strengthening to unload that tendon as much as possible. Most commonly, when it's turned into a tendinosis, it's because it has too much strain on it. So we want to strengthen the muscles that are around it to decrease the load specifically to that tendon. For the tendon specifically, we want to do eccentric exercises. This is very clearly shown in the research that this is what is going to help that tendon actually heal directly. So that's what we want to be focused on once you can do that with normal motion without hurting the tendon or the rest of your body. And the last thing is that you want to bring out the big guns in order to help healing. So a tendinosis is an area of the body that basically the brain has started ignoring. It's not bringing nutrients. It's not bringing increased blood flow to that area. So we got to figure out how to stimulate that area in order to get blood flow. This may include treatments such as shockwave, dry needling. Some people will get PRP injections in order to help facilitate healing specifically in that tendon. And this is definitely a case where you are going to need some big guns. So I'll usually start either with shockwave treatment or dry needling, depending on the patient preference. We'll check it again via ultrasound after a couple weeks and see how it's coming along. If it's not making the progress that we want to see visually and the patient's not experiencing the change in symptoms, then we'll swap and we'll use the other technique. Both shockwave and dry needling can be very effective treatments. However, everybody's different and some people will respond better to different techniques. All right, so after all of that, what can you do to avoid tendonitis or tendinosis in the future? First off, it's super important to make sure that you do an active warm-up before activity. So what I like to have people do is do some walking or light jogging for about 5 minutes. Make sure you're doing a good stretching after that before you go full into your activity. Number 2, always make sure that you're using proper technique and equipment. It's very important to make sure that you have the tools to do the job you want to do. Number 3, incorporate rest days into training. If you're pushing your body hard, your body needs a chance to rest intermittently. So you want to make sure that you have those rest days spread out appropriately. And number 4, I cannot speak to this one enough. Make sure that you address your pain early. It's way easier to deal with an active inflammatory process even if it means taking a little bit of time off from your activity, than having to deal with a tendinosis which has developed over time.